you are from the dentistry department, but an endodontist, right?
Yes.
How is it differing from a dentist?
Okay, so endodontists are basically specialist dentists. We go for 3 years of specialist course after our BDS, and we learn everything about the root canal treatment.
Okay.
So our mission really is to help you save your natural tooth. So we give a second chance to a tooth which is decayed and which has problems, and we help you keep your natural teeth in place.
Okay, all right. And what are the reasons for root canal? Like, what are the conditions?
So basically, the most common reason is a tooth decay. So this tooth decay basically starts as an innocent cavity, which is very small, and if it is not taken care at its first step, it keeps getting deeper and deeper, and it goes and touches the nerves that are there inside your tooth, which is also the heart of your tooth. That's called the pulp. So once it touches there, that's when the pain comes. So basically, anything that causes bacteria to reach inside your tooth nerves, that's when you need a root canal. Now that could be because of a tooth decay, it could be because of a crack in the tooth, which is more common in patients, who tend to open their bottles with their tooth, so they tend to crack their tooth up. Other reason could be, a fall, any kind of trauma to the tooth, which cuts off the blood supply or nerve supply to the tooth. That also can result in a root canal treatment.
Okay, so I was thinking that only root canal can be done with a wisdom tooth. No, right?
No, actually, wisdom tooth are the two that we may or may not do a root canal on. Yeah, because as a part of evolution, most of the wisdom teeth are getting impacted in our jaw and they're not erupting. So that's a part of the evolution.
Okay, and what are the causes of decay?
Sorry?
What are the causes of decay?
Causes of decay. Okay, so basically our tooth is in our mouth, right? So the mouth contains saliva, and the saliva has, like any other part of our body, we have bacteria in our mouth. Some of them are good, some of them are bad, but we all have them. So when we eat anything, especially carbohydrates or something sticky like a candy, what happens is it sticks onto your tooth. Now this is a good food for the bacteria in your mouth. So they want to go and they want to attack on that food and enjoy that food, and as a result of that they release acids. So these acids that react onto your tooth and causes the tooth enamel to wear off. So that's what starts the decay, and then the bacteria just keep going deeper and deeper, and then it touches your nerves. So your tooth is not like your skin. If you have a cut on your skin, it heals. But once a decay starts, you need a dental intervention to stop it at its first step.
So how can we understand we have a tooth decay like that?
Okay, so the easiest way to do that is we recommend you to visit a dentist twice in 1 year. That's every 6 months.
Okay.
But even visually, when you look in the mirror when you're brushing, you can see that there could be a black sort of discoloration onto your tooth. You could feel that there is some food getting lodged somewhere onto your tooth. You could have other symptoms, like you could have sensitivity. So let's say you are eating an ice cream. So eating an ice cream should not tell you, ooh,
to a particular tooth.
To a particular tooth. Or if there are multiple decays, it could happen on multiple teeth. So that's an indication that there is something that's not going right. That's your body signal telling you that there is something wrong, and that usually is a tooth decay. So that's how you know. So just being aware of what you feel in your daily life and visiting your dentist can help you.
Okay. Can it happen even without pain? Like it's going deeper and we don't get any pain.
Yes. So your tooth basically has different layers. So that's the enamel, the topmost layer, the white thing that you see. Then the second layer is dentine, and then the third layer is the pulp. So when it's in the enamel, that's the first layer, you will see the discoloration. You may even have food lodgement, but you will not have any sensitivity or no symptoms. So that's mostly a visual examination that's done by either you or by the dentist. And once it gets deeper into the second layer, most commonly, most of the patients will have some form of sensitivity, especially to sweets or to hot or cold. Cold more often. Yeah, and when it has gone into the pulp, that's when you need a root canal therapy. That's when more severe form of symptoms start coming. Like there is pain. Now pain which is spontaneous, you're not eating anything, just sitting and you have pain, or you're sleeping at night and you're having pain, and a severe sort of pain that prevents you from carrying out your daily activities without popping a painkiller, or you have a swelling. So that's more of an indication of needing a root canal treatment.
And once we come to a hospital, how do you treat it? Like it's a root canal and it's a single sitting procedure.
Okay, so see, that depends on the level of the infection. Most of the root canals can be done in a single sitting, but usually in maximum 2 sittings, the root canals are usually completed. So in the first appointment, we go ahead, we numb the patient. We don't want to have any sort of discomfort with the patient.
So it's not painful.
No, that is an age-old thing, and that's what all the movies show, that root canals are painful. But because of the modern techniques that are there, and because of the modern anesthesia that we have, they're no longer painful. You won't believe, I have patients, they come, we numb the patient, so their pain is gone, and they've not slept in days because they have so much of pain. So once we numb them, they're so comfortable on the chair. I do my procedure, and sometimes it's tedious to keep them awake. They just fall asleep. So it's gone to that level. So really, there's nothing to worry about. That's really a myth that root canals are painful. Not true.
And the first stage, you just numb it.
So we numb it, and then we go ahead and we remove the decay or whatever is the cause. So if it's a crack, we go and see the crack. So we remove all the decay, we go inside the nerves of the tooth and we pull them off, and then we clean inside. So basically what we are trying to do is we want to get the bacteria out of the tooth, right? So the bacteria have gone inside the tooth and we want to gain a sterile environment inside the tooth. So we clean it up and then we fill it with a root canal filling material, and we seal the space inside your tooth. After the root canal treatment, that's only a part of saving your tooth. The other part is you need a permanent filling. So that permanent filling is usually in the form of a crown or a cap onto the tooth. Because once we do the root canal treatment, your pain goes away, but the strength of the tooth is not adequate enough. So suppose you eat anything hard, because we have done a root canal treatment, the tooth becomes slightly brittle. And because you've lost a lot of tooth because of the tooth decay. So we want to make sure that you are able to not only stay without pain, but you can enjoy all the meals, right? So want your tooth to be strong. So that's when a crown is needed. Not everyone needs it, but most of them will need some form of a permanent filling. You can talk to your endodontist about it.
Is it a permanent solution to the decay? Like the root canal?
On that particular tooth, yes, that's the permanent solution. But after doing a root canal, a good root canal, a good crown, you also have to make sure that when you go and meet your dentist the next time, you ask your dentist to just make sure that everything is going right around that tooth. So you don't want any food lodgements, you don't want any gum diseases occurring on that. So you also have to maintain it, plus you have to still visit your dentist and make sure that everything is right with that tooth.
What can happen if we don't do a root canal even after getting a decay?
So then once you have not done a root canal, the decay kind of keeps going. So your tooth keeps getting damaged and hollowed out from inside, and eventually it breaks off. It breaks off to a point where we cannot save it by doing a root canal and a cap. And that's when you have to remove it, or the infection gets so aggressive that it results in a big swelling. So you don't want all that. So a root canal really saves your tooth, and we try maximum not to pull out any of the teeth and keep as many teeth as we can for a long time.
Right. And how's your experience? Like, before doing a root canal and after that, how patients respond?
Yeah, that's really a good question. So most of the time patients come with us with pain. So they would tell us that, doctor, we have not slept for days. Like, we've not eaten for days because it's so painful that we're just eating painkillers and we're not having. So after their root canal, or at least after their first session of the root canal, once the pain is off, they come to us and they tell us, thank you that we were able to sleep after so many days. We were able to enjoy our favorite meal after so many days. So that's something that you feel proud of. And the other thing they say very commonly is that we thought root canals are really painful, but this is absolutely not the case. Yeah, it's a myth. So they always say that it is always better than what we thought it would be.
Great.
Yeah.
Thank you so much, doctor, for your time. It was a very interesting and informative session. Thank you so much.
Thank you for having me here.